Well, one really feels for the board members of Twitter today, looking at Elon challenge them on the same website, the microblogging site. Anyway, let's get to our top stories. Why are we talking about COVID today? Why are we worried about COVID today? Because of the number in the last 24 hours, almost doubled. So 2,183 new cases were recorded in the last 24 hours. That's the number that comes in the morning. The active case load currently stands at 11,542. But it's the jump really which is worrying. So April 17th, you see we had 1,150 cases, and by April 18th, it's come to 2,183 cases. Not just that, after 11 weeks of a steady decline, COVID cases have now seen a 35% spike in weekly numbers. Weekly positivity rate has also increased from 0.27% to 0.32%. That's very minimal, but directionally upwards. So, where is the spike in cases happening? Delhi, Haryana, Uttar Pradesh. Delhi has shown the highest COVID spike, recording 517 cases in the last 24 hours. Again, the trend is upwards. The positivity rate in Delhi is 4.21%. What is the reason behind this? What is the trend we're seeing? To discuss this, I'm joined now by Dr. Sanjeev Bagai, Chairman and MD at Nephron Healthcare. Dr. Rahul Pandit, Director Critical Care at Fortis Hospitals, Mumbai, is joining us, and he's a member of the National and Maharashtra COVID-19 Taskforce. Dr. Chandrakant Lahariya, Epidemiologist, is also speaking with us on the show. Welcome to all of you, and thank you so much for joining us on the India Development Debate. Dr. Bagai, your first take really on why we're seeing a spike, and isn't it worrying?
Okay, so the first a couple of important points. The first point is I think there should be no panic, there should be no alert, there should be no scare, but there should be an utmost level of precaution. I would like to mention three important points. We are dealing with Omicron and indeed the sublineages of Omicron, which is BA.1 and BA.2, and now the recombinant, which is called as XE. What this really has done is it has picked up all the bad mutations of Gamma and Delta, mixed them together in a genetic mix, and now this new sublineage has come. So this has become a little bit more contagious than the original Omicron. It is still milder, but mild is a very relative term. So people who are not fully vaccinated or with comorbidities, pre-existing conditions, it can indeed turn out to be more serious. It is also affecting children a lot more. Worldwide data is showing 6 times more and more number of admissions, more number of deaths. But a vast majority of children have still got very mild disease. Now, we know that this is contagious more in the upper respiratory tract. The world has opened up, likewise India, the schools have opened up, and so on and so forth. There are 3 important points I'd like to make. One is that we cannot and should not forego a simple measure of continuing to mask ourselves, especially in public gatherings, in outdoor activities, crowded areas, poor ventilated areas. Point number 2 is even more important. Not only the double vaccines, but the third vaccine is important, because with Omicron, the vaccine resistance as an immune escape is twice as much as the original Omicron. And point number 3, we should try to resist as much as possible in terms of excess socializing or meeting in crowded areas. I am absolutely against closing of any institution, college, school, office. I think we need a good hybrid model. Precaution is the key word. Triple vaccine is
Meanwhile, some new data which has come in. Delhi has reported 501 new COVID cases in the last 24 hours, and the test positivity rate has gone up to 7.72%. We just said about a minute ago it's about 4.5%. So you're seeing that steady increase. The trend is upwards. Dr. Pandit, the question here is, and agreed completely with Dr. Bagai that we have to take precautions, etc. We know now, we've been hearing that for 2.5 years. Some people are following it, some people have stopped following it. But what, according to you, is the cause of this spike? Because your seropositivity rates point to very high levels of infections. You have a very good coverage of at least 1 dose of vaccine in the adult population. The booster dose is now available. Omicron had a huge impact in January. Why so quickly and so fast?
So when the cases dropped down in the month of February, obviously people stopped taking the COVID appropriate measures, which we were sort of been talking of for the last 2 years. That's point number 1. The second thing is that vaccination also has not really picked up in children and in the age group where the additional dose has now been actually allowed. Point number 3 is that we have actually had a lot of social gatherings, where be it wedding, be it just people socializing with each other, which obviously COVID had not gone away. It had just gone down to levels which were very, very low. Right now, if you're talking about 500 cases in Delhi and a test positivity rate of 7%, we are looking at how many tests must have been done. Around 10,000 tests would have been done, or less than that. So we need to obviously increase our testing. One thing which we need to do again and again is to actually keep on doing our genome sequencing and have those reports as quickly as we can. We know it takes a few weeks for it to come back, but there should be no larger backlog of cases which would then be reported after say a month and a half or so, that we had a XC variant in the month of February or so. So we should have a faster genome sequencing so that we can keep an eye on this problem. Because if this case spurt is because of some new variant, and I'm not at all suggesting that, it doesn't look that way, but then we should be quickly aware of that so that the appropriate measures can be taken. And until that, I completely agree word by word what Dr. Bagai said. We need those precautions to be taken as a self-sufficient, self-reliant, self-important citizen of the country, where they need to realize that it is for their own health and own good that these things have been spoken for the last 2 years.
Dr. Lahariya, how do you look at it? Because this is not, earlier the story was it was restricted just to Delhi. You're seeing now cases in Haryana as well. There's some reports coming in from Kerala. Are you looking at it as the classical start of the next wave? Is it showing those signs right now?
I don't think this is the start of the next wave. There are a few points which we need to remember. First point to remember is that the test positivity rate which we see now is not the test positivity rate we used to see earlier. Now only those symptomatic and individual who are developing symptoms are being tested. Earlier, everyone was being tested, so asymptomatic and mass testing was being done. So that time, the absolute number of tests was very high. So the people who were being tested positive was relatively less as a proportion. But now only those who are symptomatic are being tested. So the 5% is not same 5% which we used to have a year earlier. So we should not be looking at test positivity in isolation. That's part one. Second point, I would like to highlight that now the risk we need to break into two parts. One is the societal risk is relatively low, while individual risk is what we should be paying attention to. So in the beginning of pandemic, we need to remember everyone was at a risk because no one was vaccinated and no one had developed natural infection. So everyone was susceptible and the risk was unknown. Now people are vaccinated and also have a natural infection. So hybrid immunity there. So now what we know about the virus, that only high risk individual need to be protected. Healthy individual who are fully vaccinated, their risk is low. Risk at the level of society is low. So we need to think in terms of current surge in protecting the vulnerable, while rest of the population can continue the normal activity. Having said that, I also want to flag that while we are hearing a lot about children developing COVID-19 or testing COVID-19 positive, now we need to remember that testing COVID-19 positive is different than COVID-19 case. Testing can also happen of asymptomatic individual and other reasons. But children also developing infection even when schools were closed. We know through zero survey that 70 to 90% of children had developed infection when schools were closed and they are some way protected. Now, final point is that in the current wave, though we are hearing a lot about children testing positive, but there is no evidence that those children have developed infection in the school. They have developed infection from the other family members. And the good part is that even though children have tested positive,
which you have said, which you have been a strong advocate of, is that don't shut schools, like Delhi is planning to.
No, I don't know whether Delhi is planning, but there is no point of shutting any institution, as Dr. Bagai said, be it school, college, or any system.
Yeah.
Now the societal risk is really low. Now it's onus on the individual, and individual need to assess.
What about masking? Let me come to the question of masking, Dr. Pandit. So Maharashtra, for example, has made masks voluntary. We've reported today that Uttar Pradesh is planning to make masking compulsory in Lucknow and in NCR region once again. What's your view on this? Because that is one, COVID behavior that people have abandoned very happily and very quickly.
So one message which has consistently come across by hundreds of doctors, scientists, epidemiologists who must have come on various channels, webinars, talks, YouTubes, is that masking is important. if all of us are saying that in the same voice, I don't remember any doctor coming across any doctor or epidemiologist saying don't use a mask. So all of us are saying the same message. The message needs to really be taken seriously at an individual level. As I said, it is for your own good. Maharashtra government has made it voluntary. They have never said don't wear a mask. They have put the onus on your shoulder. Please wear a mask. Yes, you can be responsible enough to wear it in the crowded, closed, confined space where air ventilation is poor. In a playground or in fresh air, you may choose to remove it for some time. That's fine. And that's where the disciplinary thing has been taken away. It's now put back on our shoulders to protect yourself. And that message is consistent. If you may find controversy about different messages, but not about masking. Masking has been one consistent message which has been given all across, all the time by all the doctors.
Have been doubly vaccinated, and then if they've had the COVID infection, and the numbers are dwindling and it's become voluntary to wear mask or not mask, then people who are not wearing masks are not necessarily wrong.
Is that a question for me?
Yes,
again?
yes, Dr. Pandit.
Yeah. Well, I am not saying wrong or right. I think the right thing is that until and unless COVID goes away, we have seen that BA.1 and BA.2 had an immune escape phenomena seen. And as Dr. Lahariya pointed out, that we all have people at home who need to be reverse isolated. Because if we bring an infection from outside, despite being vaccinated, our grandmother, grandfather, somebody who's immunocompromised at home may actually be at a risk of catching the infection from ourselves. So until and unless the pandemic is over, I don't think masking should be given any discount. So masking should be one of the most important measures to still try and protect ourselves. Now we are talking about protecting ourselves, I'm not talking about community. You protect yourself, you automatically protect your family as well as people who you come in contact with.
Yeah. Dr. Lahariya, if I can just get some idea of BA.2, the variant which seems to have now dominated the world, according to the World Health Organization, and the context for India and the surge in infections that we are currently seeing. Is this now the same variant attacking those who have not got, the first versions of Omicron, or are we now fearing new variants coming in?
So what we need to remember that Omicron has a few sublineages, initially BA.1, BA.2, BA.3. Now there are two more, BA.4 and BA.5 have been identified. XC is a recombination of BA.1 and BA.2. Now what we know that in India, the third wave happened due to BA.2. And now almost all the variants, sublineage are BA.2. So every infection which is happening in our country, 99% or more than those are due to BA.2. So that's the only which is circulating globally and in India. So anyone, whether it's a previous infection or reinfection, because past infection or vaccination can prevent from subsequent serious disease, but past infection or vaccination does not prevent from reinfection. So all of the current infection, as far as we know through genomic surveillance, are due to BA.2. A few cases of XC have been reported, but that's a very small fraction.
Dr. Bagai, are you anticipating a rise in cases, a further rise cases over the next few weeks, or do you think this could be a one-off?
No, I think the cases will rise a little bit, but again, more we test, more numbers we will get. So the numbers itself should not be alarming. What is important is the public health message which we give. So just to put some certain important statistics so that a viewer can actually get a real impact. If both people wear a well-fitting and a high-quality mask, N95 mask, not a bandana, not a handkerchief, not a linen cloth, the level of protection which you'll get is nearing 98 to 99%. Point number two is if you get triple vaccinated, you decrease your viral load and you have a 2 times better immunity versus a 2-dose person. So get yourself triple vaccinated. It is important, especially for Omicron, because of the high immune escape. And point number 3 is we should look at how institutions at this stage, when we are reaching 188 crore vaccine, which is a huge, huge achievement, we should look at how we should keep institutions at this stage now open. And when I say open, we should look at simple guideline policies from the national government, what is called as ventilation. I think the world must focus, India must focus on appropriate engineering values of proper ventilation policies.
Yes.
Over to you.
Dr. Bagai, time to start vaccinating children in a wider age group?
Yes, indeed. I think I've been a very strong promoter of children vaccines. It's one of the most powerful public intervention tools. All the vaccines which are used in the Indian diaspora have practically no significant side effects of myocarditis, pericarditis, or thromboembolic phenomena, blood clots, or indeed anaphylaxis. It has shown excellent results. The new one, which is being used for 12 to 15 years of biological E, Cobravax is an extremely safe platform. Subunit vaccine, extremely good. The protection which you're being given to children in terms of vaccine efficacy to prevent serious disease and death is nearing 98, 99%. Children can transmit, they carry the same viral load as adults. This is an important breaking the chain of transmission. I would also like to include pregnant ladies carry a very high risk. The pregnancies also should be included in the vaccine program. There is sufficient data internationally to show higher incidence of preeclampsia complications, cesarean operations, and indeed impact to the newborn.
Yeah. So vaccinating children in a wider age group, of course, of over 12 they're allowed right now, might be the next step as cases continue to rise. We'll have to wait and watch this space. Thank you so much to all of you for joining us on the show this evening.
God bless.